Good evening, folks. Discussion B deals with aging and bone loss, particularly women. Okay, so here we go with today's presentation B for y'all. Here's a summary of the main points from the article Living Strong: How Women May Maintain Bone Health and Prevent Falls. Key insights on bone health and fall prevention for women. Aging and bone loss. Both women and men lose bone density with age, but women are especially vulnerable due to hormonal changes like menopause and reduced estrogen levels. Fall risks. Falls are a major cause of injury among older adults, often leading to fractures and serious complications. Maintaining bone strength is crucial for independent living. Bone density scans. CMS recommended for women age 60 plus. Get a DEXA bone scan to assess bone mineral content, especially calcium. These scans help determine bone strength and guide treatment decisions, typically covered by Medicare and other health plans. Lifestyle and risk management. Diet, exercise, and movement play a key role in slowing bone density loss. Reviewing family health history can help identify hereditary risk. Sharing this information with healthcare providers supports personalized care. Would you like to explore how these recommendations could be adapted into a frailty-aware or memory-friendly care model? DEXA scans, dual energy X-ray, absorbently are cornerstone in assessing bone health, especially for women over 60. Here's why they are so important. Why DEXA scans matter. Bone density measurement. DEXA scans measure the mineral content in bones, primarily calcium, to determine bone strength and density. This helps identify early signs of osteoporosis or osteopenia before fractures occur. Personalized treatment planning. Results guiding healthcare providers in recommending appropriate interventions such as calcium or vitamin D supplementation, weight-bearing exercises, or medications to slow bone loss. Folks. Okay. Give me 1 second, please. They also help tailor fall prevention strategies based on individual risk profiles. Preventative value. Early detection of low bone density allows for protective lifestyle changes, reducing the likelihood of fractures and maintaining independence, especially crucial for Postmenopausal women whose estrogen decline accelerates bone loss. Insurance coverage. DEXA scan. DEXA scans are typically covered by Medicare and other health care plans for women age 60 and older, making them accessible and cost effective for preventative care. Would you like to explore how DEXA scan data could be integrated into frailty aware care models or used to personalize interventions in homebound seniors? In addition to DEXA scans, several other tests and assessments can help evaluate bone health. Other bone health assessments: quantitative ultrasound, or QUS, often used on the heel bone, portable and radiation free, but less precise than DEXA. Useful for initial screening in community settings. Peripheral DEXA, or PDEXA, measures bone density in peripheral sites like the wrist or heel. DEXA, but still valuable for risk assessments. Quantitative CT provides 3D imaging of bone structure, especially in the spine, more sensitive to changes in tubular bone, but involves higher radiation exposure. Trabecular bone score, or TBS. In addition, an add-on to DEXA that evaluates bone mitochondrial structure helps define fracture risk predictions beyond bone mineral density alone. Bone turnover markers, or BTMs. Blood or urine tests that measure the rate of bone formation and restoration. Useful for monitoring treatment response and metabolic bone conditions. FLAX tool. A clinical algorithm that estimates 10-year fracture risk based on fracture like age, gender, BMI, and family history. Can be used with or without DEXA results. Would you like help designing a screening protocol that integrates these tools into a frailty aware or memory friendly care model or framework? Lifestyle factors play a pivotal role in maintaining bone health and reducing the risks of fractures, especially as we age. Here's how. Nutrition, calcium and vitamin D, essential for bone formation and strength. Low intake can accelerate bone loss. Anti-inflammatory diets. Diets rich in fruits, vegetables, omega-3s, and whole grains may support bone resilience and reduce systematic inflammation. Protein intake. Adequate protein helps maintain muscle mass, which supports bone structure and balance. Physical activity, weight bearing exercises, activities like walking, dancing, and resistance training stimulate bone formation. Balance and flexibility training, yoga, tai chi, and targeted physical therapy reduce fall risk, improving coordination and stability. Lifestyle habits. Smoking reduces bone mass and interferes with calcium absorption. Alcohol, excessive intake can impair bone remodeling and increase fracture risk. Family history and risk awareness. Genetic factors. A family history of osteoporosis or fractures can signal higher risk. Health monitoring, regular checkups, and bone density assessments like DEXA scans can help track changes and guide interventions. Would you like to co-design a lifestyle-based intervention model tailored for memory-friendly or frailty-aware environments? We could integrate nutrition, movement, and environmental supports into a cohesive framework. Great question. Here are some of the most common misconceptions about bone health and realities and challenge them. Common misconceptions versus reality. Misconception and reality. Bone loss only affects women. While postmenopausal women are at higher risk due to estrogen decline, men also experience age-related bone loss and fractures. If I'm not in pain, my bones are fine. Osteoporosis, osteoporosis is often called the silent disease because bone loss occurs without symptoms until a fracture happens. Calcium supplements alone prevent osteoporosis. Calcium is important, but without vitamin D, protein, and weight bearing exercises, it's not enough to maintain bone strength. DEXA scans are only for people with osteoporosis. DEXA scans are preventative tools recommended for women 60 plus to detect early bone loss and guide proactive care even before symptoms arise. Fractures are just part of aging. Many fractures are preventable with proper nutrition, movement, and environmental adjustments. They are not inevitable. Once bone loss, once bone is lost, it can be rebuilt. While full while full restoration may be difficult, bone remodeling is possible with targeted therapies, lifestyle changes, and medications. Would you like to explore how these misconceptions could be addressed in caregiver training or public health messaging, especially within frailty aware or memory friendly frameworks? To help debunk to help debunk common misconceptions about bone health, here are some trusted resources and tools referenced in your document and art in the article. Evidence-based resources that clarify bone health myths. A resource, what it offers: accreditation, DEXA scans, preventative bone density testing recommended for women 60 plus, covered by Medicare, helps detect early bone loss without even symptoms. Living Strong article, FRAX tool, a clinical algorithm that estimates 10 years before or 10-year fracture risk using age, gender, and BMI and family history, can be used with or without DEXA results. Okay, bone turnover makers, BTMs, blood or urine tests that measure bone formation and rest, rest, restorative rates, useful for monitoring treatment response. Lifestyle-based interventions emphasize nutrition, calcium, vitamin D, anti-inflammatory diets, physical activity, bearing balance training, and avoiding smoking, alcohol document. Okay, these resources not only clarify misconceptions like the idea that bone loss only affects women or that fractures are inevitable in age, but also offer actionable strategies for prevention and care. Would you like help designing a public facing guide or caregiver training model that uses these tools to correct misconception or misinformation and promote bone health quality? Okay, guys, so that is B for you. I'll be back on shortly with C. Give me a bit for C, please, and I'll be back on with that for you shortly. For now, Gator Wellness, take care, folks.